On September 21st, 2012, home care workers and their allies came together for a National Day of Action. In their home states and in Washington, D.C., they signed petitions, they visited their legislators, and they called for minimum wage and overtime protections for home care workers. This video was shot in D.C.
Oh, this is just so thrilling to be here and be a part of this and to feel the energy from all the direct care workers, not only just for the PA folks, but for all the different states across the United States. One voice coming together, so it's very, very powerful.
I do not for the life of me understand how you can justify not providing basic wages for people that are doing this job role. And how can you say, as example, you have to be certified, but I'm not going to pay you for that. What at the time you said, I'm not going to pay you for that. So I'll get off my soapbox here in a minute. I am mad as hell at my senator that is voted against this, okay? I am befuddled because he is Hispanic. And I am befuddled because of the population that is minority and Hispanic, that he could not step back and look at the people that are doing this job role and say, well, wait a minute, let's listen beyond the noise of the agencies that say we can't afford this, and let's look at the individuals. So we don't have an appointment with him, but we're going to do a drive-by. Okay?
I'm here too as a matter of justice for the caregivers. If we say we need 1 million more caregivers by the year 2016 to even begin to care for my population now, even to begin to care for individuals, how do you bring people in? How do we bring young people in and say, this is a wonderful job, you will love it. It is so gratifying. You may wind up on food stamps. You won't have enough money to provide for your family. You'll never be able to take a vacation. You won't be able to do anything you want to do. You may not be able to buy food. You may not be able to heat your house, but boy, it's a wonderful profession. Join us.
I'm 71 years old. I'm retired. I can afford to not work for minimum wage. But these kids coming up that's going to start families, we're going to lose them if we don't give them a chance to make a wage. They'll go down the street and work at McDonald's.
And my husband's a geriatrician, and he also stands with you all. He knows that the work he does is the most important, and he couldn't help his patients without your help.
12 years ago, I lost my mother. My mother went through the hospice program, and I was able to keep her at home. And it was painful, but yet it was dignified, and people took care of my mother. You know, and it was something that I couldn't do myself. And lo and behold, a few years later, my mother-in-law got very sick, and once again went through the same scenario. And I was so grateful to those folks. I mean, they came in being cheery. You know, it wasn't like, and then they knew they had terminal patients, and they're very cheerful. They make the patient feel at ease. They keep everybody at comfort. Without their assistance, I don't know where I would be. I'm on vacation today, and it's a great vacation day being able to come down with you folks and be here.
We are housekeepers, psychologists, nurses, cooks, among many other things. It is really hard for me to understand why in this country where we are so concerned with the human rights at this point at a time, we who care for our country's elderly and people with disabilities do not have basic labor protections, like minimum wage and overtime.
The lady I care for, she is now 59 years old. She is mentally disabled. She is nonverbal. Her mother has since passed. So the only family this woman has is me, my mother, my child, and my husband. My daughter is 22 years old. She watched me and my mother take care of this woman all of her life. She is now a certified CNA. In college to become an RN, because she doesn't like what she sees in the nursing homes. She doesn't like the pay that we receive, I've been doing this for 9 years. I get paid $8.88. The lady I care for is total care. Make sense? Not even close.
I'm private caregiver right now for the last 4 years. I'm here to support people who don't get a minimum wage and overtime protection. I do get both, but I'm here to advocate for the people who don't have either of them, because I have been in the industry and I know how hard it is.
I wanted to just share some thoughts as to why communities of faith are getting involved in your campaign. It's the question, what kind of society do we aspire to build? Do we want a system that says the very people who care for my loved ones, who change their bedpans, who extend and enrich their lives, do not deserve the most basic protections of work? Do we want to continue that system? No. So blessings to all of you today as you take this powerful message up down the block to the halls of power. Thank you.